an obese 71-year-old woman in the orthopedic clinic physiotherapy ward.
Good morning. We have an appointment with Mr. Adamczyk, a physiotherapist. I'm here with my 71-year-old mother.
Good morning. Yes, I see your visit is scheduled for 10:15. So please both take a seat and wait a moment to be called to room 8.
Of course, thank you. Mum, let me help you sit down.
Mrs. Miria Chikochka, please come in. Good morning. My name is Matthew Adamczyk, and I will be your physiotherapist.
Pleased to meet you. I'm Maria, and I feel I really need your assistance. Today my daughter drove me here, as I cannot get around on my own lately.
We will work on your condition, and I hope you will get assistance, not only today.
We live in the neighborhood, and I'm going to bring my mum to rehabilitation for the entire treatment cycle.
Let's start the examination now, Mrs. Chikochka. Please tell me about your recent complaints. I have your documents already from the orthopedic ward, and the diagnosis says hip osteoarthritis.
That's right. I've been suffering from it for 5 years, but quite recently the symptoms have become aggravated. I feel pain in my right thigh, mainly when I exercise, but also it appears during rest.
Please show me where it is located.
Here, in the groin, and then it radiates to my thigh, to the front and middle part of my thigh, and then it goes down to the knee.
So if I understand well, it is a radiating type of pain, and it appears even at rest.
Yes. What is worse, there is accompanying pain in the area of my hip blade, which slows down my daily activities.
Please tell me more about your mobility.
I'm slightly limited in terms of mobility, especially outside the house, and I've developed a limp because of the growing discomfort.
When my mum was hospitalized, the medical team mentioned that there were limitations on the internal rotation and extension of her joints.
Sure, we are going to work on ROM, which is range of motion, and this will tell us more about your joint mobility. However, for now, I would like to ask you, Mrs. Chikochka, to please stand up for me, as we have to verify a few elements. Let me help you with standing up.
Oh, you're very kind. Thank you.
Can you please walk towards the door? Fine. And now back to me. Okay, now, please stand on your right leg. The other leg should be bent at the hip joint and raised. Okay? Fine. You can put it down. And stand in the same position on your left leg. Great. You can put it down.
I felt discomfort when standing on my right leg, you know.
Yes, I could clearly see it, and it also proves that your thigh abduction muscle group must be strengthened. Now, please lie down on the couch in a supine position. I will give you a hand with this. Great. Please bring your right knee to your chest as far as possible, and then hold it there. Do you feel any stretching in the right groin?
I do.
Your extended leg is lifting off the table. Let me measure the angle at the knee now. Perfect. And finally, the third test. Lie on your back again. I am going to work with your right leg now. I will grab it by the foot, and at the height of the knee joint, I will perform a bend. How does it feel?
Painful again?
It is natural in osteoarthritis of the hip joint. If the external rotation of the limb in the hip joint increases during flexion, this is a condition. Movement sometimes causes pain.
So, are you perfectly clear about my diagnosis?
Indeed. For the final confirmation, let me have a look at the X-ray results. Have you taken them today?
Of course, my daughter has the documentation in the folder. Can you find it, Monica?
Thank you. Yes, typical symptoms. Narrowing of the right hip joint, some bone cysts. Okay, it's time now to talk about your treatment plan. First, it is recommended that you lose some weight. How do you feel about that?
I will do my best. You know it's a process, but I also understand how important it would be for my health and overall good feeling.
That's right, and I can offer you magnetotherapy and cryotherapy every day in the morning hours.
Fine with me.
And next you will have exercises in water. There are no contraindications nor risks associated. We aim to reduce pain and disability and slightly improve the quality of life after the completion of the treatment cycle. Up to 3 weeks of exercise in water.
Sounds very promising.
And finally, I will meet with you to perform supervised aerobic and strengthening exercises. I really hope your stay here will bring you much relief.
Thank you so much for all the detailed explanations and presenting me with the treatment plan. See you tomorrow then.
Thank you too, and see you soon, Mrs. Chikochka.